What about the vision of Apollo hospitals? Does your father still put you in the direction, or put you and your sisters in the direction of the way he sees this hospital chain?
You know, for a long time it was like, listen, you know, this is what we have to do. But of late, it's like, you know, what shall we do? How shall we contribute? You know, what do we do together? So there's a lot of dialogue between the five of us about what we need to do. And then we have some great advisors, you know, on the board, within the system, professionals who are working with us. So I think it's like a collective wisdom of, you know, formulating the vision and what we have to do to go forward. But I think, you know, our chairman still does.
How do you see healthcare in India, Preetha?
You know, there's a lot to be done.
Really?
You know, let's get down to that. There's a Bharat and there's an India. And I think the India part, you know, is going places. We have centers of excellence, many islands of excellence, and they're doing a phenomenal job. You know, our outcomes are on par with the rest of the world. The Cleveland Clinic might have like a 98.5% success rate in cardiac surgeries. We have the same, if not better. So I think in pockets we're doing a phenomenal job in terms of, you know, high-end care, tertiary care, investing in great technology. All that is happening, so no complaints about that. But then when you look at the other side of India, if you look at the Bharat side of India, there's so many people who need to be looked after. You know, sometimes I worry that 200 miles out of the city of Chennai or Delhi or Bombay, you can't even get good clean drinking water. So I think, you know, we have to worry about the health and hygiene of people. We have to see, you know, what can we do to take the health quotient up? How do we educate people on, you know, good lifestyle, healthy lifestyle?
Right. But Preetha, how does one get a government to actually agree to give the hospital business, the hospital industry, this health, this infrastructure status that you're talking about, this label? You've been trying for this for a long time. So what's the way? Why aren't they listening?
Eventually they'll wake up and listen. You know, roads have become priority, telecom has become priority, so many other things, including IT and tourism. Healthcare actually gives employment for more people than IT does. And they don't seem to realize it because healthcare is not a very organized sector. So the data, the information is still not available for them. You know, they think, oh, for-profit hospitals, and that's all there is about private healthcare. What about the not-for-profit? What about the NGOs? You know, there's so much work happening, so many jobs being given. So I think at some point the government will listen. If not tomorrow, the day after.
So you're going to keep plugging this, Preetha?
I'm not going to stop.
No, you're not going to stop? Well, wish you all the best.
A lot of us won't stop, but I think eventually they'll listen.